CDK4 and CDK6 are kinases which are linked to the function of cyclin D in the cells, which are crucial regulators of progression of cell cycle, in particular the initiation of cell cycle and the transition of the G1S phase. This is strictly linked to cellular proliferation, and this pathway, the cyclin D CDK4/6 pathway, is deregulated in many cancers, and especially in breast cancer. Not all subtypes of breast cancer do have alterations of the CDK4/6 pathway at the same level. We know that from preclinical studies that especially the luminal subtypes and the HER2 subtypes are breast cancer subtypes that rely the most on this kind of pathways, and therefore inhibition of this pathway by new molecules is particularly interesting in these clinical subsets. For example, new preclinical data have been presented showing that there's a synergism between the CDK4/6 inhibitor palbociclib and specific anti-HER2 targeted treatments, including pertuzumab. Therefore, for example, in this specific topic, a trial has been planned in combination with pertuzumab to look into a clinical population whether these preclinical findings are actually confirmed. Most of the data on these inhibitors, though, have been so far developed in the luminal population, and recently data have been presented from a phase 2 trial on palbociclib, which is a specific CDK4/6 inhibitor, in combination with letrozole for the treatment of first-line metastatic patients with ER-positive and HER2-negative disease in this case, with a very good result, very promising results, with almost doubling of the progression-free survival in this population. And this led to a phase 3 trial that is now ongoing and will be concluded in the next few years. So this data looks very encouraging, and a number of trials with different compounds are now ongoing, trying to dissect different aspects of the many questions that there are about the right allocation of these drugs to the right patient populations.